It is estimated that humans have between 20,000 and 25,000 genes. These genes, which are the basic physical and functional unit of heredity, are made up of DNA, and they hold the vital information that makes each one of us unique. These genes act as an instruction manual, and they work and interact together in a complex way to support human life. Genomics is the study of all of these genes, or what we call the genome, and their interactions with each other and with the person's environment. Stemming from genomics is an emerging medical discipline called genomic medicine that involves using a person's genomic information as part of that person's medical care, especially for diagnostic purposes and for full treatment decision making. One of the more impactful uses of genomic information is in cancer treatment. Cancer cells, while carrying the genomic makeup of the host individual, also have genetic mutations that cause them to behave the way that they do. Genetic mutations in cancers, which are called markers, can be detected using a genomic technology called next-generation sequencing, NGS. These markers can be linked or associated to an extensive databank of previously published clinical studies and research, as well as ongoing clinical trials that have implications on guiding the physician or the oncologist on choosing the best drugs for chemotherapy or immunotherapy, or both. This makes the treatment of cancer more precise and effective with decidedly less side effects. Furthermore, additional mutations can be detected during the course of treatment to allow precise adjustments in the treatment plan. It is for this reason that Helice Genomics Sciences Incorporated was born. Helice is a platform that connects physicians and individuals to genomics laboratories based abroad and provides them a portfolio of the latest genomics-based tests and assays to arm them with powerful and actionable options for navigating the right medical care for the patient's individual needs. Helice has 4 categories of genomic testing products. First is solid tumor genetic profiling tests that detect genomic alteration in the cancer tumor itself. This information is correlated to potential relevant therapies, such as associated chemotherapeutic medicines, targeted chemotherapy drugs, and drugs used in select clinical trials, and are prioritized based on the strength of clinical evidence. The second is pharmacogenomics, a test that looks at genetic variants in the patient, the presence of which may have the potential to affect drug absorption, metabolism, and activity. With this information, clinicians can be guided on treatment decisions regarding better choices for medications, reduction in adverse drug events, and avoidance of trial-and-error drug selection and poor dosing. The third category is liquid biopsy test. This is useful when a tissue biopsy is not available. Using a blood sample, the test can quantitatively detect cancer-driving gene variants and drug resistance markers. Based on the results, targeted cancer therapy drugs that can best be used for the patient are identified, and drugs that will likely not show any benefit due to the presence of resistance markers can likewise be identified. The test also quantifies microsatellite instability, MSI status, which is important in predicting a cancer's predisposition to mutations, and may call for the use of another class of drugs called anti-PD-1 therapy, checkpoint inhibitors, which is a form of immunotherapy. And lastly is wellness screening tests. These tests offer healthy adults who may or may not have a strong personal or family history of disease an opportunity to learn about how their genes could potentially impact their health and focus on prevention. Test options may include the analysis of up to 147 genes that are known indicators of significantly increased risk of developing hereditary cancers, cardiovascular conditions, and other medically important disorders. So, how does Helice's genomic testing process work? Step 1. Once you and your doctor have decided the proper test to take from the roster of genomic tests that Helice has, we will send you more information and forms, as well as help you in the creation of your account in our online platform. Step 2. Your specimen is collected based on your specific needs and requirements. For solid tumor profiling, Helice requires a formalin-fixed paraffin-embedded FFPE tissue block, also called a paraffin block, that is obtained from the hospital's pathology department. Together with the paraffin block, 8 to 10 slides of the tumor and 1 slide with H&E staining of tumor tissue with normal tissue are required. For pharmacogenomics, liquid biopsy, and wellness screening tests, usually either a blood sample or buccal swab or saliva can be used, although blood is the preferred tissue. Step 4. Helice will then send your samples to our partner genomic laboratories abroad. Step 5. Your samples will then be analyzed for mutations within specific genes that are related to the conditions you are at risk for. Step 6. Once test is done, the detailed results will be sent to your Helice online account. Step 7. Armed with your genomic information, your doctor will then discuss your personalized medical management and intervention. Helice believes that the future of personalized healthcare is genomics, and we are bringing this to you right here, right now. Let us help you. Find out more at helicegenomics.com or email us at info@helicegenomics.com.